Welcome esteemed participants to the esteemed enclave of We Groups. We are gratified to announce our felicitous alliance with Anaga Health as our esteemed channel partner. Within the confines of this illustrious congregation, we shall embark upon a cerebral odyssey delving into the intricacies of a chosen discourse. It seems like you're asking about burns, their types, and first aid treatment. Burns are injuries to the skin and underlying tissue caused by heat, chemicals, electricity, or radiation. Here are the types of burns and their first aid treatments. Types of burns. 1. First degree burns, superficial burns. Affect only the outer layer of skin, epidermis. Symptoms include redness, minor swelling, and pain. Example: mild sunburn. Typically heal within a few days. First aid involves cooling the burn with cool water and applying aloe vera or moisturizing lotion. 2. Second degree burns, partial thickness burns. Affect the epidermis and part of the underlying layer, dermis. Symptoms include blistering, severe pain, and swelling. May require medical attention depending on the size and location of the burn. First aid involves cooling the burn with cool water, covering with a sterile dressing, and seeking medical help. 3. Third degree burns, full thickness burns. Destroy both the epidermis and dermis, often extending into deeper tissues like fat, muscle, or bone. Appear white, charred, or leathery. Nerve endings may be damaged, so the burn might not be painful initially. Require immediate medical attention and often surgical intervention. First aid involves covering the burn with a sterile dressing and seeking emergency medical assistance. First aid treatment for burns. 1. Stop the burning process. Remove the person from the source of the burn, fire, hot object, etc. If the burn is caused by a chemical, remove any clothing or jewelry contaminated by the chemical. 2. Cool the burn. Hold the burned area under cool, not cold, running water for 10 to 20 minutes. Do not use ice, as it can further damage the skin. 3. Protect the burn. Cover the burn loosely with a sterile gauze or clean cloth. Avoid applying any ointments, butter, or other home remedies. 4. Pain relief. Over-the-counter pain relievers like ibuprofen or acetaminophen can help relieve pain. 5. Seek medical attention. Depending on the severity of the burn, seek medical help immediately or visit an urgent care center. Medical attention is necessary for second-degree burns larger than 3 inches in diameter and all third-degree burns. 6. Prevent shock. Keep the person warm and comfortable, but do not immerse severe burns in water. Remember, these first aid measures are meant to stabilize the person until they can receive appropriate medical care. For severe burns or burns involving the face, hands, feet, or genital area, seek medical attention immediately. It seems there might be a slight misunderstanding in your question. I'll clarify. If you're asking about second burns, it's possible you're referring to second-degree burns, also known as partial thickness burns. Second-degree burns are injuries that affect the outer layer of skin, epidermis, and part of the underlying layer, dermis. They are more severe than first-degree burns but less severe than third-degree burns. Here's some additional information on second-degree burns. Appearance. Second-degree burns typically present with redness, blistering, swelling, and severe pain. Causes. They can be caused by exposure to heat, such as hot liquids, flames, or contact with hot objects, chemicals, electricity, or radiation. Treatment. For minor second-degree burns, first aid involves cooling the burn with cool, not cold, water for 10 to 20 minutes, covering it loosely with a sterile dressing, and seeking medical attention if necessary. Larger or more severe second-degree burns may require medical treatment to prevent infection and promote healing. This may include cleaning the wound, applying antibiotic ointments, and possibly debriding, removing damaged tissue. The area. Pain relief with over-the-counter medications like ibuprofen or acetaminophen may be recommended. Healing. Second-degree burns typically take longer to heal than first-degree burns, usually within 2 to 3 weeks. Proper wound care and medical treatment can help minimize scarring and complications. If you meant something else by second burns, please feel free to clarify, and I'll be happy to assist further. It seems like you're asking about third-degree burns, also known as full-thickness burns. Third-degree burns are the most severe type of burn injury, extending through the entire thickness of the skin and often affecting deeper tissues such as fat, muscle, or even bone. Here's more information about third-degree burns. Characteristics. Appearance. Third-degree burns often appear charred, white, brown, or leathery. The affected area may be numb due to nerve damage, so the person might not feel pain initially. Causes. These burns can result from exposure to flames, hot liquids, chemicals, electricity, or prolonged contact with extremely hot objects or surfaces. Severity. Third-degree burns are considered medical emergencies and require immediate professional medical attention. Complications. They are associated with complications such as infection, fluid loss, hypothermia, loss of body heat, and impaired blood circulation. They can also result in severe scarring and long-term physical disabilities. Treatment. Third-degree burns require specialized medical care. Immediate treatment may involve measures to stabilize the person, such as ensuring an open airway, providing oxygen, and monitoring vital signs. Treatment in a hospital setting typically involves cleaning the burn wound, removing dead tissue, debridement, and possibly performing skin grafting or other surgical procedures to promote healing and minimize scarring. Pain management, infection prevention, and supportive care, such as intravenous fluids, are also important aspects of treatment. Recovery. Recovery from third-degree burns can be prolonged and often requires extensive rehabilitation. Physical therapy, occupational therapy, and psychological support may be necessary to help the individual regain function and adjust to any permanent changes in appearance or mobility. It's crucial to seek immediate medical attention if someone has sustained a third-degree burn, as prompt treatment can help improve outcomes and reduce the risk of complications.